The first speaker will be Julianne Busta. She went to the University of Akron and obtained a bachelor's degree in child development and a minor in family development. She became interested in patient navigation programs in 2011 and completed the Harold P. Freeman Patient Navigator Program, becoming certified in patient navigation. Julianne started working at Metro Health in November of 2011 as a patient navigator for head and neck cancer patients as well as sickle cell patients. She is very dedicated to these two patient populations and is very passionate about patient advocacy and finds the Patient Navigator program very rewarding.
Hello. Like Linda said, my name is Julie Busta, and I am the Sickle Cell Patient Navigator here at Metro Health. When I first started this position, I knew a little bit about sickle cell disease, but I wanted to learn more. Dr. Choi educated me further about sickle cell disease, and the more I learned, the more interested I became in sickle cell. Soon after, I began meeting the patients. Every person I met was unique in their own way. Once I started seeing the patients more often, they started opening up to me. They told me their stories about how sickle cell has affected them. One patient stated that she tries to come in and get treated often so that she could spend time with her child. She stated that it wasn't fair that her daughter cannot do what normal children do in the wintertime, such as making snowmen or building snow forts, because the cold affects her mother's sickle cell disease. Another patient stated that he had a great job working in a pharmacy, but because of the times he had to miss work due to sickle cell related pain, they let him go. One of our patients used to be a head chef, but had to stop working because of the challenges that sickle cell disease brought him. The more stories I heard, the more I wanted to do something for these patients. I was not quite sure where to start, so I got on the computer, pulled up Google, and typed in sickle cell disease. I was shocked when there weren't many resources for these patients. So many other patient groups have many support services available to them. The only supportive resources I could find were Sickle Cell Disease Association of America and Kincaid's Kindred Spirits. I attempted to contact each group and patiently awaited a response. Luckily, Kincaid's Kindred Spirits contacted us and came to Metro to help us coordinate our program. Aside from this, Dr. Choi had a plan to give these patients their own treatment room. Now that I was here to help, we finally set the plan in motion. We were able to have a room set specifically for sickle cell patients, and we named it the Rapid Care Clinic. Patients can call the same day and get an appointment to come to the Rapid Care Clinic, where they will receive treatment from nurses who are familiar with the patient so they can receive more consistent and compassionate care. Also, their pain crises will be taken care of in a more timely manner. Once the patients started using the Rapid Care Clinic, they got to know each other better and started their own little in-clinic support group. They enjoyed talking with each other, and most of them never realized how many patients were being treated for sickle cell disease in the same place. This is when I realized that we needed to have some type of monthly get-together for these patients. We called a meeting with Kincaid's Kindred Spirits, and they gave us ideas on how to get support groups started. I got ideas from different nurses on what topics to talk about. It was so exciting. Our first meeting was in January, and it was more of a meet and greet meeting. One of our patients, who is here, volunteered to cook and made a wonderful meal. The patients were able to stand in front of the room and give their stories to others. One patient stated that he was 40 years old and has never been in a room with this many sickle cell patients before. It was truly inspiring. It really was a wonderful event. Since then, I have gotten someone to come talk to the patients about Reiki therapy, and we had another meeting about sickle cell disease where the patients were able to get a more in-depth idea of what sickle cell entails. I have also contacted a music therapist as well as a financial counselor. We are continuing to conduct monthly meetings for these patients because they need support just as much as any other group of people dealing with the medical condition. I'm so happy to have had the opportunity to work with these wonderful people, and I hope to continue to expand our program and make a difference in their lives.